by giving the first opportunity on this session to Dr. Emhamad Elmansori. He's a senior lecturer at Omar Al-Mukhtar University in Libya. He's an experienced academic on entrepreneurship and SMEs, and he's going to talk to us about the Libyan perspective here. Again, as I mentioned earlier, just to remind all the people who are either joining us now or just who are started from the morning, all the biography of all these speakers available in our website, was.org.uk. And we're going to give each one 15 minutes, 12 to 15 minutes, and then we will wrap up with a question and answer, and then we go for our lunch break. Now, Dr. Al-Mansuri, if you can hear me, if you can come on, we can't see you, Professor Al-Mansuri, Muhammad Al-Mansuri.
I'm trying, yes.
Yes, can you start your presentation?
I can't hear you, Prof. Alam.
Yes.
Can you hear me?
Yes, we can hear you, but can you share your screen?
Yeah, is that okay?
Yes, we can see your slide. Go ahead. Yes, we are there. Go ahead.
Hi, everyone, and good morning. I know that the time is different, and we present in our conference using video technology, and our followers from different countries of the world. So, hello, everyone, and thank you, Professor Alam, for giving us this opportunity. My presentation today is about the impact of coronavirus pandemic on small and medium enterprises in Libya. The outlines of my presentation is the introduction, followed by theoretical background of small and medium enterprises, then research methodology, data analysis and findings, and we will conclude that with some recommendations. As you know, during the 20th century, small and medium enterprises sector has played an important role to a majority of the developed and developing countries' economy. And many researchers have demonstrated that significant role of small and medium enterprises in both developed and developing economies in combating unemployment and increasing the rate of economic growth and innovation as well. So in Libya, actually the exact number of small and medium enterprises is still unknown, but the Ministry of Trade and Economy in 2006 estimated that the number of small businesses in Libya at about 180,000. However, some Libyan officials, some officials from Libya believe that there are many other unofficial or informal businesses, as small and medium enterprises often operate outside the formal economy to avoid, taxation and other fiscal and regularity consideration. Hello? Hello? Hello?
It's clear, sir.
Yes, we're clear. We're following you.
Okay. And as you may know, that numerous studies have found that countries can improve their economies through enhancing their small and medium enterprise sectors. And many researchers discovered that small and medium enterprises can play a significant role in terms of generating income, developing skills, absorbing labor, and elevating poverty, also increasing innovation, and trying to both the sectors which can be economically and geographically diverse. Actually, the year 2020 started out with many global effects that people and business have not expected, including COVID-19, political tension, and oil price dropping significantly to unexpected prices. Among all these, COVID-19 has arguably impacted businesses the most in the past 6 months as compared to other mentioned factors. And according to World Health Organization, coronavirus are a large family of virus which may cause illness in animals and humans. In humans, several coronavirus are known to cause respiratory infections ranging from the common cold to more severe disease such as SARS and MERS. So the most recently discovered coronavirus causes coronavirus disease in COVID-19. Since the coronavirus outbreak announced by governments, Libya business activities have been severely slowed. The researcher launched a survey on the sorry.
Yeah, we are hearing you okay.
Okay. The researcher launched a survey on the condition of micro and small and medium enterprises. Therefore, this paper focus on the impact of coronavirus pandemic on small and medium enterprises in Libya, based on primary data which has been gathered using questionnaires. The empirical paper aims to, or the aim of this paper is to examine the impact of coronavirus on small and medium enterprises in Libya. In addition, to ensure that policy measures are appropriately designed to meet their needs, and addresses the question whether the COVID-19 has any impact on the activities. So the paper has been organized for many parts or some parts or several parts. I will go with how to define small and medium enterprises. And as you know, there is, in general terms, there is no standard definition of small and medium enterprises. But the main factor is how many employees in this business. So this table shows the number of employees in some small and medium enterprises in some countries like Egypt, Lebanon, Oman, Jordan, UAE, Tunisia, and Libya. And for small enterprise in Libya, for the employee, less than 25 employees, and for medium enterprise, less than 50 employees. Small and medium enterprise have specific needs that must be met by the state of governments, such as companies generate huge revenues for each countries. The research methodology, as a result of difficulties in counting all small and medium enterprises in Libya, the sampling approach used was snowball sampling, which means that the number of small and medium enterprises that fit the definitions were asked to complete the questionnaire. Then the participants forward the questionnaire to other they know matching the same definitions. So using the snowball sampling method and according to the research needs of the target firms, the questionnaire data collection process took place from March 2020 to June 2020, the questionnaire were sending to the selected firms. During the period, due to the recent lockdown, the Libyan response from small and medium enterprise were extended till the 15th of June 2020. So responses were obtained 5,900 from most of Libyan cities. And the result of this paper, or the analysis of the result of this paper, as you can see from this figure, that the majority of participants are self-enterprise with 45%, followed by construction enterprise with 39%. The rest is made up of agriculture-based enterprise and at 16%. So, and the questionnaire asked about the resumption, and as shown in this figure, the majority were expected activity to return in a month. 30% expected within 2 weeks, and only 22% had expected the activity to stop for more than 3 months. Then the figure 2, it can be seen from this figure. The most responses indicated that about 41% of respondents said that more than 75% of their employees were unable to work because of the lockdown, while the second was 36% who have lost 25% of their employee. From figure 3, is the percentage of the economy employees who are unable to work due to the pandemic. And in the question about in the question about financial problems for the economies during the outbreak, the chart show that 34% from the symbol of the research shows that the most important financial problems for their companies during the lockdown is paying their staff wages and social security charges, followed by the payment of rent by 28% and 22% personal expenses, and just 12 other expenses, while the repayment of loans finally came up at 4%, indicating that the small and medium enterprises are not receiving sufficient support from financial institutions. In figure 4, because of the pandemic, the question was, is your company currently considering layoff or has already done some? So the analysis from figure 4 shows that about 4,200 of the small and medium enterprise of the symbol of this research are with about 72% is considering layoff or has already done some, while only 1,700 companies are not going to do. From figure 5, based on the survey symbol, reduction of operation costs, for example, layoffs and salary reductions, with about 41% was ranked on the first place as a priority in alternative to cash flow. for their business during the lockdown. While this shows that the second was no cash flow shortfalls problems in their businesses, and 15% of the research sample was having loan from families or friends, and 8% was taking loans from commercial banks, which show a lack of loans from commercial banks.
Dr. Muhammad, can you hear us?
Yeah, I'm hearing you. I'm just looking for the last. I think I missed some slide here, but is okay. I will go there with the conclusion.
Yes, it's better.
Yeah, I will go with the conclusion. The paper examines the impact of COVID-19 on small and medium enterprise in Libya, and it was found to have a significant impact on small and medium enterprise, in addition to ensure that policy measures are appropriately designed to meet their needs, and addresses the question whether the coronavirus has any impact in the activity. The paper also, the finding include the most important financial problems for companies during the lockdown, was, as I said, was paying the staff wages and also reduction of operation costs. The questionnaire shows that the majority of owners of small and medium enterprises did not expect their business to halt for more than 3 months, and many respondents believe that more than 75% of their employees were unable to work due to the lockdown. The findings include the most important financial problems for the companies during the lockdown was paying staff wages, also reduction of operation costs, for example, lives and salary reduction. The recommendation of this paper, the recommendations of this paper, as shown, the findings of this paper indicate that a stakeholder in the small and medium enterprises process, including small and medium enterprise owners, financials and banks, and the governments should undertake new policy and strategy to overcome the challenges confronted by small and medium enterprise and financing providers. Therefore, the following recommendations should be presented. Government can aid small and medium enterprise at this time, reducing taxes or cash grants or loan or any type of financial aid for enterprises that have stopped working during the lockdown. Opening channels of communications with funding institutions and encouraging them to support this sector, establishing a platform for home service professionals to use for receiving bookings and quotations requests for jobs, including cleaning, plumbing, electrical, air condition servicing, renovation, handyman service, and interior design. That's the end of the presentation. Thank you very much for your attention.
Thank you very much, Dr. Muhammad Elmansori. I think we need to go back to the, if you can just maybe stop sharing the screen, it will help us. Thank you very much. Okay. I think it was very useful to start this session by looking at the impact of this COVID-19 pandemic on the small and medium enterprises in Tunisia, in Libya. I would like now to, if we can take the screen back, stop sharing the screen, Muhammad.
Okay.
Yeah.
Okay.
Yeah. So now we would like to move. Thank you very much, Muhammad. We'll come back to the question and answer after we finish with the other two speakers, but it was very wonderful to listen. And thank you very much again for really doing your best regarding this connectivity and give us or overcoming all the challenges and connect with us from Libya. Now I would like to introduce Professor Njidda Gadzama. Professor Gadzama is a well-renowned professor, expert in the zoology. He's a zoologist. He's an environmentalist as well. Professor Gadzama is the former Vice Chancellor of the University of Maiduguri in Nigeria. He will take us now one step further and looking at the impact of COVID-19 on health, education, research, and development in Nigeria. So, Professor Gadzama, the floor is yours, and you can start now.
I am to present this paper. The purpose of the paper is to present the impact of COVID-19 on education, health, social economy of Nigeria, and to a certain extent the world. And thank you for inviting us to contribute.
Professor Gadzama, Professor, sorry to interrupt you. Can you press on show on the PowerPoint? Can you press that show so we can see a bigger screen of your slides?
Right. I am trying.
Yeah, on the bottom, you can see that. Just press show, which is to show the screen and be large.
Or press F5.
Okay. Right.
Yes, this one.
Some problems here, but can you?
No problem.
Can you hear me?
Go ahead. Just continue, Professor. Go ahead.
All right. And we are to contribute to the recent wonderful series of interactive global debates on COVID-19 by WASP and ably chaired by the President, Professor Al-Mukhtar, and to also participate in this special 18th International Conference virtual of WASP, holding in London and sharing invaluable information on this pandemic disease. As part of the introduction, is COVID-19 causing deglobalization? I remember clearly during one of the panel discussions that Honorable Minister Dr. Gail Ribert of St. Lucia was of the opinion that yes, it is deglobalizing, but COVID-19 breeds nationalistic effect where nations and states are more concerned with health and welfare of their citizens. However, everybody, young, old, medium, poor, super rich, rich, all in the whole world are now concerned. Except for World War II, no happening brought humanity together for the past 100 years as COVID-19. One concern, that is COVID-19. COVID-19 reached West Africa in February 2020, and things are at standstill as other parts of the world. In Nigeria, initial epicenters are Lagos, Ogun State, Abuja, Federal Capital Territory, and Kano are summarized in Table 1 and the figures. But for design, methodology, and approach in lockdown, materials for these papers were obtained from print and electronic media in view of the national lockdown and ban on trans-state travels, no travels at all. 2, We refer to daily briefings of the Presidential Task Force of Nigeria on COVID-19 and ministries, for example, education, health, ministries of information, and many agencies provided very useful information. Conferences, interviews, debates, talk shows were other areas where we found information. And our findings, Table 1, we summarize incidences of March to June, and also figures 1 to 9 would confirm. But epicenters, as I said, is Lagos, Abuja, Ogun, Kano, but this is not really stable. It changes from day to day. One, the impact on academic research and development, very serious. The academic year 2019 and 2020 is a disaster year. In fact, it could be called a wasted year. Schools, colleges, universities closed in March and may not be open until maybe October or November or December. We don't know when we can open the schools, as the minister has disbanded the opening of school in July. Increasingly, online teaching is now seen as a credible way of sustaining learning. Now, as we shall see, Nigeria has 36 states, but we are divided into zones. So we see Northwest zone, we see Northeast, and then we see North Central, and then Southwest, South-South, Southeast, and we have 6 zones. Now, our work, we have tried to collect information on COVID-19 from all the states, but it is better to put them into zonal, as I have discussed. Now, next. These graphs, they are not very, very visible, but you can see they are zonal. The first one is from Southwest with the highest incidences, then the Northwest, then the Northeast. North Central is not so much. The least is in the Southeast. Now, South-South is catching up. That is why I said you cannot say this money for this zone, this number for this zone. No, it changes. This map shows the whole Nigerian state with infectivity. Now, the darkest states or zones are those with the highest, the lightest with the least. In fact, Cross River was priding itself that it did not have COVID-19 as of June, but now, no, forget it. Every state in Nigeria has COVID-19. Now, the impact on Nigeria continued. Our findings, we continue. Our findings is such that the impact, particularly we have said on education, but the impact on the economy is overwhelming. Hotels lost so much that their best option was to lay off staff. It is really very bleak. Fund allocation to federal, state, and local government dropped by 10%. I would have thought it's bigger than this. Implementation of minimum wage has been postponed. Lower petroleum export prices dropped down to woefully $20 per barrel. Suspension of some capital projects and the review of the 2020 budget has been reviewed. Overhead expenses cut by 50%. Suspension of employment indefinitely, restricted foreign trips, and closed border and airports. And this is very heavy financially. Now, disruption of any educational process negatively affects research, development, and national progress. Why? Because education provides knowledge, and knowledge provides innovation. With innovation, countries can move. Now, COVID-19 affecting Nigeria and the whole world. The recession now is approaching 1930 because of the world wars, negatively affecting United Nations Sustainable Development Goals. Was global panel debates and chaired by Professor Al-Mukhtar is very commendable. Topics like future of work in post-COVID, the African continent challenges in dealing with COVID-19, Black Lives Matter, impact of corona-like pandemic on higher education, research, and governance strategies. Now, this I was supposed to have participated, but as you can see, we have problems in connectivity. Now, the future of youth in post-COVID-19, very, very important. And many, many others that evoked positive and international response reactions. Well done, West, and well done, Professor Alam. COVID-19 University System in Nigeria, virtual community conference of University of Maiduguri, organized by Professor Gadzama, a director of our consultancy unit, was very successful. And this is the topics included COVID-19 and university system, telling us that planning is very important. Without planning, we may just hold up. Lessons and strategies for leveraging on digital transformation tools, showing us that leveraging on email is very important now. The conventional has dwindled to e-learning. University education system and COVID-19, the American experience, even in developed countries like America, e-learning now has become a source of flexible way of sustaining education. Recommended open and distant learning for Nigeria with COVID-19. Consequently, we now know that we must constitute a high-powered committee to see how we can develop e-learning in Nigeria. Research and development grossly affected by COVID-19, but the research at the present is heightened by effort in vaccine development. 89 vaccines at developmental level, some at field trials that is almost ready, possibly by December. Apparently the first one may be functional. 75 billion sourced by some nations for managing COVID-19 internationally. I would suggest that WHO receive a lot of that money to acquire protective gears for brave health workers, because many of them are contacting COVID-19 and dying. WHO is praised by AU. Why? Because His Excellency President Ramaphosa praises WHO that gives the world, that gives Africans some guidelines. And without WHO, I don't know what will happen in the poorest countries in Africa. WHO promotes One Health. What is this? It is health for every living creature. Health for farmers, health for you in the cities, health for farmers' livestock, including wildlife. Zoonotics is very important. After all, they say bats are the carriers of coronavirus. So health for all. Lockdowns unfriendly to governance. In fact, some riots have been triggered by lockdowns because somebody is daily earner and you put him in the house and locks him out. Where is he going to find food for his family? And he's going to defy that lockdown. Executive government and National Assembly have less oversight duties because they cannot meet, they cannot discuss in public, they must wear their face masks at all times. Palliative is the provision of food and other items for needy people under lockdown. But you see, this is very expensive. No government would want to continue with that indefinitely. Therefore, it must be public-private practice. Now, in conclusion, by end of June 30th, there were more than 10 million cases globally, with 5% death. By July, it is 4%. But in Nigeria, June 30th, we had 250,000 cases with 590 deaths, which is 2.5%. And right now, 20th of July, we have about more than 36,000 with 778 deaths, which is 2%. Now you will say, there is less death in Africa. There is less death in Nigeria. No, it's a matter of semantics. Have you done investigation on COVID-19? Tests. Only Lagos in Nigeria would raise its head and say, yes, our data is correct. But others is just some assumptions. And therefore, this is not really the kind of data that I would want to depend on. But our present experience, this is call to duty by humanity to ban weapons of mass destruction, nuclear, biological, biochemical, and I understand secretly there is one electromagnetic that is even more dangerous. The world is a small village now. From Wuhan, something triggered. Now there is no village in Nigeria that you don't hear COVID-19 or coronavirus. This is new language. Most pressing serious issue right now is for us to direct research in developing effective and stable vaccine against COVID-19. Maybe this can continue until December or even into 2021. Medication, nutrition, environmental, plasma research, masks are all concerns. But cooperation of the public in abiding with the protocol is very disappointing. The hand washing, maintain social distance, wearing masks, no large gatherings. This is not being adhered to. And you can see peaks all over the place. And if we can even go back to the graph, to the last graph that we showed you, by end of June, the graph was shooting up. Now, the peak is not yet around. The peak is not yet around. There is famine in the country, probably due to triple tragedy. We have COVID-19, you have to sit at home. Who is going to farm? You have Boko Haram, if you go out, they will shoot you. And if you travel anyway, you can be kidnapped. So it is a terrible situation. Now, let me acknowledge that, well, anyway, I don't have conflict of interest. What I've said is what I've said. Now, acknowledgement, I acknowledge and welcome the great synergetic activities of national and international groups on coronavirus and COVID-19. In particular, the series of panel discussions and debates chaired by Professor Allen is simply out of this world. We should have our local ones. Recently, Professor Gadzama, the director of consultants of the University of Maiduguri, organize a one-day virtual interactive conference on coronavirus pandemic and university education system in Nigeria at the University of Maiduguri, my own university. Both that and the WASP debate constitute an encouraging sign of critical public assessment of the problem by public stakeholders. This is very, very important. Carry on with your activities, Professor Allen. Nigerians appreciate the work of the COVID-19 Presidential Task Force of Nigeria in managing the disease in the country. In fact, that task force is so appreciated. Every evening, they report to the whole country, telling the country what is going on, what the state of the problem, and how to manage the state by everybody. Now, I wish to thank my friends, Professors Rashid and Professor Bogoro, for encouraging me, along with my university, University of Maiduguri, for participating in this wonderful conference. Thank you very much, and God bless. May we be protected from COVID-19, please.
Okay, thank you very much.
Any...
No, continue, Professor.
This is the end of my contribution, please. Thank you very much.
Thank you very much, Professor. That's extremely useful and is giving us a much good idea as to what is happening in Nigeria. And I think we are very blessed this session. We have the case from Libya, and now we have you from Nigeria. Now we're going to move to much looking into the third world perspective on a wider system approach. And we are very pleased and honored to have a leading and distinguished consultant in public health from Dudley Council here in the UK in Birmingham. She will take us through a much more wider perspective, and then we bring you back this, if you stay with us, Professor Gadzama. I would like now to introduce Dr. Mayada Abu Affan, and as I said earlier, all the bio of all people today, tomorrow, all of them are available online. Mayada is a senior consultant. She advises many organizations, including the WHO countries, and she's going to talk to us about a wider system approach to combating COVID from a wider perspective in developed or in third world countries, or maybe developing countries. But we have put Mayada after Dr. Emhamad and Professor Gadzama, so at least she will have seen first-hand experience of those two countries. They both in Africa, but Libya also considered as an Arab country. Libya got its own challenges, and Nigeria. So Dr. Mayada, the floor is yours.
Okay, thank you very much. This is my first presentation online, hence the hiccup. So thank you very much, Professor Alam and Watts and my colleagues, and it was a pleasure listening to everyone. I am going to talk about a system-wide approach. I'm going to look at why do we need a system-wide approach, especially in developing countries where the political, economic, healthcare, and social systems are not well developed, and also the what needs to be done, and then the how, and how the system-wide approach will work, and then the so what, which is the implications and the long-term learning from COVID. As you all will agree with me, COVID is a global pandemic at a large scale. The last similar scale was the flu vaccine in 1918. And then the high attack rate and the high mortality rate, especially on high-risk groups, forces us to think widely. It's to think beyond health. And as I said, it has a huge social and cultural implications and also economic implications, as my colleagues alluded to. So to be able to hit the ground running in countries where the health system is not well developed and other systems, we need to adopt the emergency planning and disaster management models. So this presentation is based on applying these models and identifying a system and suggesting elements of that system. in the main essence of an emergency planning and disaster management model is clear command and control structure, and having a strategic and operational, which we call them gold and silver cells or approaches. So what are those components of the system? As I said, in terms of the statutory services, okay, and also the non-governmental and societal. So the system is relying on the government, the NGOs, and the social system. In terms of like the strategic and the command, if we look at the command and control, if we look at the gold cell, what do we mean by the gold cell? The gold cell has to be chaired by or led by the highest rank in the government, a prime minister or someone who has been delegated to by a prime minister, and then it needs to have key components. Ministry of Health is only one of them. It needs to have the finance, media and culture, interior affairs, and Ministry of Education as main stakeholders and main partners, sharing the responsibility equally. And I'm going to reiterate this: COVID is not just a health problem. So what would be the function? What would be the overall responsibility? Not just the clinical management, but also resource mobilization, social management and social mobilization, developing recovery plans, managing the communication and behavioral change approach, as I'm going to discuss later, the role of communities, and also the enforcement and law and order that needed to manage such a high-scale pandemic. So the silver or the operational level, to be able to manage the problem from every aspect, these are suggestions of 8 strands based on the UK management, and as I said, hybrid and underpinned by the emergency planning and disaster management. We need the first strand is a manpower and clinical environment. Your staff, I'm going to go through each strand in more detail. And then the clinical management of the disease, the management of supplies and equipment, then your hospital capacity or secondary care capacity. You need to look at business continuity in terms of health and wider than health, especially when you have lockdowns. And then you need to really focus on your communication and how you're going to manage societal behavioral change, and then mobilizing communities. And then in the end, you need your research and development and also your recovery planning to be able to manage at such a high scale pandemic. So if we look at the manpower and clinical environment, this is your clinical staff, doctors, nurses, allied health professionals who are working in hospitals, in isolation centers. You need to have your know and monitor workforce contingency planning. You might need to redeploy staff who are working in cold cases to manage only COVID, because you are going to stop other cold cases. You need to maximize preventative measures to protect your staff, the PPE to staff, and also all the facilities they are protected from the infection. And also you need to look at the logistics of the staff, their transport, their food needs, and how you are going to protect their families. For example, in the UK, some hospitals, they rented rooms, hotel rooms, and especially hotels are empty, so the staff can stay there and not go back to their families to reduce the risk of transferring the infection to their families, especially if they have high-risk families. And then the clinical management in a developing countries, you need clear leadership structure at the national and local level. You need a body that is responsible of, as a collective, on developing clinical guidelines and management pathways. I know the WHO developed guidelines, but you need to customize them to the country and the culture and the law and enforcement of that country. And you need to keep them updated regularly. You need to inform the government decision-making process, the lockdown, when to ease it, what businesses to close and what businesses to open, and also development of self-care and prevention guidance. COVID has put really strong emphasis on self-care of mild cases and self-care of the general population to prevent themselves from getting COVID in terms of maximizing their immunity and adopting the prevention messages and adopting like the public health guidelines in terms of smoking. So we were asking the population to reduce the smoking because it impact on their chance of getting COVID and also the severity of the disease. They need to manage their long-term conditions to keep up their immunities. They need to adopt healthy lifestyle and these things. And also this strand, they need to look at the infection protection and prevention guidelines and how they get adopted. And then the other strand is the PPE resources and oxygen. You need monitoring these supplies and ensuring continuous supply of equipment and medicine. The other side is the secondary care capacity. Okay, so you have your hospitals, and if you needed to do isolation centers, you need to take that decision. You need to monitor your hospital capacity, ICU, intensive care unit capacity, and you need to develop alternative pathways when capacity is exceeded. If this hospital is full, then you need to know where you can divert patients. Business continuity, and I think this is the most important, and it was one of the major challenges in the UK, which is how you ensure you continue to manage non-COVID patients, so so people won't die because of heart disease or a stroke, because all services are focused on COVID. So that's a very important strand, and you need to think: do you need to have separate health care facilities for COVID and non-COVID, or you can have them both in one facility, but with clear demarcation between the two and making sure that non-COVID patients are protected. And I think one of the most important strand is managing communication and behavioral change approaches. And I don't think many of developing countries have managed to use this effectively. So you need to utilize the maximizing utilization of mainstream media, social media, and community leaders to influence behavioral change. People, they have to know the epidemic curve, and they have to follow it and know where they are in the epidemic curve, because it will give them an idea of the start, the peak, and the end. And also, they have to know the situation on secondary care. What is the hospital capacity? So they make sure that they don't increase the pressure on secondary care, and that they can manage themselves. So this is where you manage demand on healthcare facilities. And also you want to enforce the prevention messages like the hand washing and distancing and all that, and then enforce the law and order, or remind the population of the law and order messages. Then community mobilization, because as I said, COVID, in terms of capacity, workforce capacity, and in terms of economic capacity, really have passed all economic systems and healthcare systems, even in the UK. So you need to look at volunteering capacity. No system was able to manage COVID alone without looking at volunteering and looking at community mobilization. And then in terms of the volunteering, not just volunteering in terms of manpower, but also in terms of donation, money, food, and equipment. I remember Siham talked about food banks and these things. For example, in my area, we got, we as a local government, we got lists of all vulnerable people who are shielding or not allowed to go out. And the ones who don't have money, we provided food supply for them delivered to their home, so they don't have to come to the food bank. So, and then we developed interventions to improve social cohesion, especially older people who are sitting at home scared and being told not to go out for at least 3 months. If they don't have family, we used to call them and make sure they are fine, and we encourage neighbors through the media to check on others by social media and by phone. So the community mobilization is really an important element within COVID management and within third world domain, because you can rely on non-governmental organization, or you can rely on the communities. Communities back home are very well connected, and they are able to look after each other if they are given the guidance and have been shown how to do that. And the last strand is research, development, and recovery. We need, each country needs to develop its own local trials and try its own medicine. Because of the impact, there are a number of COVID strains, and some countries hit harder than others. There is the impact of racial and the impact of long-term conditions on COVID. So you cannot rely on, for example, UK trials alone. And also you can take part or taking part in international trials. And then the recovery planning. When we look at recovery planning, it has to start from the beginning, when it's declared as a pandemic, and we need to look at different recovery time frame and severities, and also different scenarios of the new the new now, okay, or how the new future is going to look like. So, and so what? So by adopting this system-wide approach and by utilizing emergency planning and disaster management, we are able to address all aspects of the pandemic: the clinical, the social, economic, and cultural. And also by thinking about the recovery plan at the start and having different scenarios will enable us to manage recovery at the moment we start to that recovery. And then we need to learn from COVID. So the like food for thought I will leave you before lunch are, in terms of the things we are going to take from COVID long term, are the infection prevention and protection measures. They are here to stay. The hand washing is here to stay, and to some extent the social distancing and the respiratory hygiene. Also the role of community cohesion and solidarity is something we can take, and it's something to stay, not just in the future, not just in managing like a pandemic, but also in managing long-term conditions and other health challenges. Thank you very much.
Okay, Siham, sorry, Mayada, thank you very, very much, Dr. Mayada. If I can see, or I can get all of you, if you can stop the sharing of the screen, Dr. Mayada, so we can go back to all of them. Now, thank you very much, Dr. Mayada. I think that was very interesting, very inspiring. I think it's very good to see the connections between what she mentioned, Dr. Mayada, and what Dr. Elmansori mentioned about business. Mayada talked about the business side, which she said is very important. She also talked about research and development, which Professor Gadzama also mentioned. Professor Gadzama and Dr. Emhamad Elmansori. Now, I would like to open it for questions. I have questions here arrived because, you know, we're following this on the Facebook as well. If there's anyone have any question for any of the three speakers, Dr. Elmansori, who talked about the impact of COVID on SMEs, small and medium enterprises in Libya, Professor Gadzama, who talked about the impact of COVID in Nigeria, but it's quite generic, although it was referring to Nigeria, but he referred to research and development and so on. Dr. Elmansori, can I'm trying to unmute you. Now, Professor Gadzama and Professor Emhamad Elmansori, if you can just show on the screen or the video. Now, any question? If you would like to ask any questions, just raise your hand. So it's question time. You can also send it through the chat if you like. Sorry, I'm just looking at. So any question? I'm trying to look at all the screens here. Now, Professor Gadzama, I got a question here for you. I can't just see you, Professor Gadzama, can you hear me? Professor Gadzama, can you hear me? Emhamad Elmansori, can you hear me? Okay, let me then ask Mayada's questions here. Mayada, the question we received here, Dr. Mayada, is that all those, because in WASD, we are, as I said in my introduction earlier, we are very keen on, yes, Professor Gadzama, Muhammad. Yes, you can hear me, okay. Now, yes, Professor, okay, so Professor Mayada, sorry, I will come back to you, apologies for that. Professor Gadzama, just a quick question. Dr. Mayada have just talked about research and development, which you did explain about it, but given of your wealth of experience, you know the UK very well, you know all these policy and the directorate here in the UK. To what extent you in Nigeria have seen what Dr. Mayada have said about this much more generic approach to, or a wider system approach to third-world countries, Nigeria is an example. Do you think there is one approach can really be adopted across all, say, Africa, for example? Or do you think each country, it has its own, its country-specific perspective? For example, Nigeria, Libya, Sudan, Egypt, South Africa. Do you think we could adopt one approach or a wider system approach to all these countries the same?
Well, Mr. President, I don't think there is a lot of collaboration at the present time. But really, I feel that AU should be a central point where everybody will come and pick whatever is appropriate for that country or for that region. But it has not been happening. It's unfortunate. But I also want to ask my previous speaker on the matter of the race thing. I know I listened to you some time ago, fantastic debate by Farida and her associate on why some races in Britain also have contacted this disease and they have died more than other races. I don't know. I don't think it's genetic. I would have liked my co-speaker to talk on the environmental issue. I think there is a lot of concern on the environment rather than the racial aspect. Thank you.
Okay, thank you. Mayada,
from your question.
Yes. Yes, Professor.
From your question, we need for African Union to be more proactive, to bring more togetherness so that we can learn from each other. Take, for example, this the green wall from Somalia to Senegal. There is nothing that has tied Africa together like that one, because everybody is interested in the Sahelian zone. You see, so African Union should do more of bringing us together to learn from each other. Thank you.
Thank you, Professor. Mayada, before I come back to you, maybe I ask Muhammad Elmansori. Dr. Elmansori, can you hear me? Dr. Emhamad Elmansori, can you hear me? You hear me, Doctor? Dr. Elmansori, can you hear me? I mean, Libya really having a serious problem with the internet. But let me go to Mayada. Mayada, there's two questions here. One of them is, before we come to the black or the ethnicity issues to do with COVID, but this is definitely a question that's been going on and on, even after we brought Professor Farida and Suhair, and they discuss it. Still, we have these questions. But before that, Professor Gadzama said to you, the big problem is really collaboration. He said he can't see collaboration in African Union. Of course, you cannot comment on the African Union or international collaboration. But to what extent do you believe why the system like yours, which you are talking about, needs a regional and maybe continental collaboration in Africa, in Middle East, or in Asia, whatever it is, because this is a wider system. So the more you can get more people to apply it is better. And the second part, if you can respond to him, but if you could really be as, I know it's quite difficult to put you on the spotlight, but some people, they said has nothing to do with genetics. And we have listened to some reports, even from in this country, they saying, maybe the blacks, they are getting it because of vitamin D and so on and so on. I don't know, there's lots of things going on. The NHS, they have their own report, which you know it better than me. So do we really, those black people or those from particular ethnicity, are more susceptible to get this COVID or not? I think that question is still for an ordinary person, he needs or she needs a much more easy answer. I know you're going to say this and this, but if there's any easy answer, we will say yes, because black people, they will get it more because of this, or maybe Asian people or whatever, why they get it more or less. Whatever it is, the answer, the more easy and simple for an ordinary people who are watching us will be better. So go ahead, yeah, Mayada.
Okay, thank you. I'll address the collaboration question first. What I wanted to say and the take-home message is COVID is beyond health. Okay, so within one country, they need to collaborate and collaborate very heavily, and they need to own the problem. And in the suggested structure is the goal has to be chaired by the highest rank in the government, that because of the power. Okay, but who would convince the governments to adopt that approach? I think something like the African Union or even the WHO. All the WHO guidelines was on the what. It didn't go into the how in that details. It didn't stress the system-wide. They need to utilize your law enforcement as well as your media, as well as the economy, as well as the communities and the volunteering. Not just volunteering for workforce, but volunteering for money. So yes, collaboration at a local level and then at regional and international and global level. In terms of the ethnic minorities, there are many theories. So there are facts and there are theories. The facts are the infection rates amongst BAME, which is Black, Asian, and minority ethnic groups, is higher. And the mortality and the severity of the infection is higher. So that's proved by statistics. The question is why? There are many theories. Some of them is because some of the long-term conditions like diabetes, like high blood pressure, are more higher in ethnic minorities. So their immunities is already compromised. Okay, and this is why. And another theory is people from ethnic minorities are most of them low rank frontline workers. So they are likely to be exposed to the infection more than people who are affluent. Because if you look at the history of COVID in the UK, when it started in February, it was among the affluent people who managed to travel into the skiing resorts or coming from China on holidays, and they got but once the community transmission started, it became the disease of poverty. Because people cannot shield, they have to work. So these are really the theories. Genetic, probably because of the long-term conditions, and poverty is associated with obesity and unhealthy lifestyle, with smoking, and these are all magnifying factors or risk factors for severe disease, and also them not being able to protect themselves.
Okay. Now, Mayada, just maybe to finish this question, but let me just check on Muhammad. Dr. Elmansori, can you hear us okay? Dr. Muhammad Elmansori.
Trying, Dr. Alam.
We can hear you. Can you hear us?
Okay, yes.
Yes, Dr. Muhammad, can you comment on this, given that you are in Libya? To what extent you agree with what is Professor Gadzama said, and also Mayada now just said, Dr. Mayada, collaboration is a key to get us out of this particular country like Libya with all these challenges. If they can collaborate maybe with North African or African or others. Muhammad, can you hear us? I mean, you can see the difficulty, the challenges. I can see him, we lost him completely. But I think we already, I think 15 minutes or 20 minutes above our time, but the good thing is we already have 1 hour for lunch break. It's now being cut short down to half an hour. I would like to finish this session by thanking gratefully all our speakers who joined us from Libya. Dr. Emhamad Elmansori, senior lecturer from Omar Al-Mukhtar University. He is an experienced academics and practitioners in small and medium enterprises and innovation. And also Professor Gadzama, who joined us from Njidda Gadzama, who joined us from Nigeria. Professor Gadzama is a well-distinguished internationally zoologist and also environmentalist. He used to be the vice chancellor of the University of Maiduguri. He's a well-respected academic worldwide. Dr. Mayada Affan, who joined us from Birmingham. She's a well-respected consultant in public health. And I think the message we get from Mayada is quite important. We said this earlier and all along, the combating COVID is not a health issue, rather than, it's not a health issue alone, but it's a more wider issue. And it needs a public health perspective, a public health vision and direction, like what Mayada said. We need all to work together. Earlier, Dr. Siham mentioned about, we asked her about how New Zealand managed to be as an example of combating this COVID-19, and she said solidarity, respect. So the issues she referred to, they are not really medical terminologies, but more of social science issues like solidarity, respecting each other, working together, teamwork. She mentioned teamwork. Teamwork is something normally we teach in business school rather than in medical school, although medical school they do. Now, Muhammad Elmansori, can you hear me? Well, I can see you now. Dr. Elmansori, can you hear us? I think we have to finish the session here. I think it's exactly 3 minutes to 1 o'clock. Muhammad, can you hear me? I'm just trying to give you the last chance. We can see you, but we can't hear you. Can you hear us? So if you could join me, all of you who are watching in the normal way, I think I wish we have been physically able to see this to show them our appreciation to their talk. But if you could just all thank you them with me from all your places. Thank you very much for all of you. And we will see you in half an hour.
So please remember, if we all help and do a little bit, it will make a big difference.